Hello, everyone. I'm Henning Kalver, CEO of Imagine Health. Today, I'm delighted to speak with Mr. Dipankar Nayak, CEO of Deep Longevity. We'll explore how this company is reshaping the way we measure and understand aging through AI, and why is it so important and useful for healthcare decision makers, clinic owners, biohackers, and anyone who cares about extending the health span. Let's start with the big picture. Longevity interventions have become very popular, but in my opinion, they only make sense if we can really measure the impact. A perfect biological age test is fast, convenient, accurate, affordable, and provides actionable advice. Dipankar, why is it important to understand and measure aging? And what has changed in recent years that aging has become measurable and unleashed basically a whole new industry?
Hello, Henning. I'm always excited to talk about longevity and the role deep longevity is playing in this industry. So it's great to be chatting with you. And first of all, thank you so much for having me. Aging is the biggest risk factor for chronic diseases and eventually mortality. The issue is it's a disease which is not being treated as one, and hence its progress is poorly measured. I strongly believe that everyone who is interested in their health should know their biological age, measure it on a regular basis, and then take the appropriate steps in consultation with healthcare practitioners to reduce their biological age. When you look at chronological age, it tells you very little about your health status. It is fixed, it is irreversible, but your health is not. There is always room for improvement. And that's what the focus on preventive health is. And one big step towards that is knowing your biological age, which is the summary of your health. Without tracking biological age, any interventions that you are doing to improve your health in terms of improving your diets, positive supplementations, infusions, you are going about without really knowing what is making an impact and how much. You're trying different things to improve your health, but you're never sure about your progress. This challenge, this need is what deep longevity is filling with their aging clocks. The need is huge for a aging clock that is reliable, scalable, robust, that works well across populations. And we think we have done a very good job to enable that. Our goal is simple, that we want people to live longer, healthier, more fulfilling lives. And one way of doing that is to track your health based on your biological age.
What has happened in perhaps technical or medical advancements that aging has become measurable and has unleashed this industry of longevity and healthy longevity? Maybe you can help us and the audience to understand why in 2025 this is such a big deal.
Yes. So I think increasingly a number of thought leaders across the world have begun to accept and internalize the fact that aging is a disease. Second thing is, with the advent of AI, people are and companies like us have been able to digest very large data sets and benchmark health based on those healthy data sets. This has enabled people to measure aging using a variety of data types. Now, that is a bit of debate in the industry in terms of which data type should you adopt and what works best. And there are several considerations to that. And I'm sure later in this chat we'll touch upon those topics. But the key thing to understand is that we are now able to look at very large data sets across populations using novel AI models and use that to benchmark the health of people. And we are able to do it using a plethora of data types, which could be your blood biomarkers, epigenetic biomarkers, microbiome. This could be facial data. Deep Longevity is doing research on a number of these areas, and other companies are looking at even other data types. So, a lot of options have come up which were not there in the industry before. And this is a very exciting proposition in front of everyone.
So, if we can measure aging better, the next question is what's the impact? Who actually benefits from this?
Yeah, and this is the part which really gets me going, because I think understanding aging and knowing your biological age is the core of preventive health. And when you apply the preventive health lens to aging, you can see the application of such technologies across industries. And we have seen that at Deep Longevity. We have seen adoption of our aging clocks across industries. The topmost beneficiary in my list would be longevity clinics, which are mushrooming all over the world. These are practitioners who have adopted longevity wholeheartedly. And now they are looking for the right tools to, on one hand, measure and diagnose their patients and the clients, and then on the other hand, how to treat them in terms of their interventions. The right adjacent to them would be the hospitals. The hospitals are now beginning to shift from chronic care, from episodic care to preventive care, getting more involved in patient engagement. And now they are seeing that there is tremendous opportunity to actually evolve new commercial models. They can go to the market and they have the infrastructure. Right? They have their personnel, the providers, the doctor, the physicians, the hospitals. They have people who are coming to them when they are sick. If they are able to move the narrative and have people reach out to them before they get sick, they suddenly have access to a population which is 10 times what they are doing today. So there is a huge opportunity for them to create new commercial models based on these technologies. Secondly, I will look at the insurance industry, which underpins healthcare almost everywhere. And when you look at the insurance industry, there are two clear use cases that emerges. One is customer engagement. The industry is vested in keeping their captive population healthy. That's one way they can run a very profitable business without increasing their premiums. And the way to do that would be to have their captive customers stay healthy so they have less and less claims. But it is easier said than done. And we have to give credit to the industry in terms of the number of new initiatives, digital initiatives that they have undertaken. You will find almost all large insurers having some sort of a health app and then pushing notifications. And I'm sure most of us get those in terms of health activities that they would want people to undertake. We think in those, amongst those initiatives, giving people an opportunity to measure their biological age would just sit right. This will be a tremendous nudge for people to think that I need to do something about my health. There's so much opportunity to gamify a statistic like that or present it in different novel ways. The other aspect of insurance industry which we think the aging clocks can potentially disrupt in a very transformative and positive way is the way policies are underwritten today in terms of helping the industry define new risk stratification strategies. The industry has a very standard way in which they underwrite risk. They will look at a person, they will look at their underlying health conditions, look at age and gender, look at the aggregate data the industry has published in terms of claims the previous year, and then based on that they will have the range in which they would be writing their premiums, and most of the companies would follow that model. But if you are a 50-year-old who is running marathons and half marathons and is very fit and probably has a blood work resembling a 40-year-old, you shouldn't be paying the premiums of 50-year-old, because you can demonstrate through your blood work, you can demonstrate through your biological age that you belong to a much younger cohort. And this opportunity, I think the insurance industry should give to their clients. The third segment is belongs to the employers and corporate wellness. They are vested, they are invested in the health of their employees. If the employees are healthy and they are not taking sick days off, then they are more productive. The companies are more productive, then they are more efficient, they are more competitive. And that's what all the employers want. Again, the employers have, and across the world, there are various examples they have taken, lots of initiatives. You, of course, have employee health insurance. But again, the focus is always in terms of reactive care, in terms of providing care after an incident has happened. And here is an opportunity for employers, and again, I sort of touched upon those points, to share something like biological age with their employees and motivate them with such a useful healthy, productive statistic. And we see employers taking a lot of interest in biological age in the near future. The next industry, I think, which can and which truly, truly will benefit from biological age predictions are the diagnostic labs. We have to understand here is that the output from the diagnostic labs is what we are using to make our predictions. So they have already done the work in terms of collecting the sample, processing the sample, and giving all the values based on the samples. Where they are stopping short of is sharing the insights. So this is an opportunity for the labs to do the downstream integrations with our APIs and provide that value and really stand apart in the marketplace. Can you imagine if labs in Thailand tomorrow start sharing blood reports and in that they have a field which says this is your biological age? That would be so interesting. That would be so fascinating for people. And then the people like you and me, the individuals, the biohackers. With everything, there is always the lead users who will adopt technology. When you have new phones and new devices coming, there is always a set of people who will go for it. And the same is for healthcare as well. So we see these biohackers, health conscious people who are interested in preventive health, who are interested in being healthy, long, productive life. And we see them adopting biological age and looking to get this statistic available. This is something which we think will drive the impetus in the industry, will give motivation to all the industries that I've mentioned so far. When they see there is a bunch of people who are looking for personalized care, who are looking to guidance in terms of improve their health and therapy and the right interventions, and this will be the trigger which will really boost the industry. So yes, I think we are at the stage where fast, affordable results are practical. We are making them available. It is just about the industry realizing the benefits and adopting this technology.
Some companies are happy to disrupt one industry, and you just listed a handful that are potentially disrupted by deep longevity in your AI algorithms. That's truly exciting. I'm in Thailand. We're surrounded by longevity clinics, as you mentioned. Some of them have already implemented other biological age tests, especially epigenetic clocks. How is deep longevity different? What would you tell a general manager, a clinic owner that is utilizing epigenetic clocks? How does your technology differ or add additional value?
Yeah, and I say this to my team as well that if you come across a longevity clinic that is using epigenetic aging clock, that is great because the adoption has already happened. So here we have a set of people who have understood the value of biological age prediction and have included that in their protocols, in their practices. And we want more and more such people to be the industry. We want people to understand the value of this technology and then take it to their clients. The debate is epigenetic age the right one? And again, I think the best way is for us, and that's our approach and strategy as a company, is to be just in touch with these clinics and say how things are faring over a period of time. And there are a few things that we have heard, and this is my point of view, and this is how I see things personally. The way epigenetic testing is happening today in the industry is there are a few companies, a handful of companies based in the US and EU, and they have their own diagnostic kit, which they share, which these clinics use. So, by definition of this model, there is huge delay. The clinics would be collecting the samples, they would be sending it to the company, which will process the data in US or Europe, and then they will send it back to the clinic. And this might take anywhere from 3, 4 to 6 weeks. By the time the health status of the person is already changed, there's a lot of things that has already happened. And that's really not how you want healthcare to work. If I am an HNI who has come to a longevity clinic, I would like to have that conversation with my physician right there when I'm in the clinic and not after 6 weeks. The second thing is they are expensive. When you put in all of this supply chain and logistics in place, the costs sum up and they come to a good number. Third thing is, and this is where I think there's a lot of debate and a lot of healthy debate here is we think epigenetic clocks have limited actionability. It's hard to fashion interventions based on the epigenetic age because of a number of reasons. One, the clocks are very sensitive. So it's hard to tell what has caused a change. It could be a number of factors. Second, when you are sending samples across continents and just sending samples over and it's taking days and weeks, there is always some sort of a damage that would happen to that sample. So it would introduce its own errors. And when you combine all of these factors, and then you think, based on this, I am trying to create an individual protocol and giving advice to my clients, the delta is just way too much. We think an easier, much better way to engage with clients for the longevity clinics is to use Deep Longevity's AI driven blood age clock. This is trained on massive data sets, is based on commonly available blood reports. These reports are generated in local labs in their local languages. The results are instantaneous and they can be used anywhere in the world. We have a white box approach. We are not saying that collect your sample, send it to us, we will process it from our labs. We are saying you process the reports from your trusted labs and then share that data with us. We will look at the data, we will come out with insight, make predictions on biological age, but also give you deeper insight into health and then back it up with recommendations to improve your health. All of this comes in a very neat report, comes as a package that is extremely useful and like ready to use for the longevity clinics. Our clocks are reliable, reproducible, scalable at a population level. The results, as I mentioned, is fast. You get it in minutes. It's fully automated, AI driven. There is no human intervention. There's nobody taking that sample, running it through reagents, looking at different instruments, and then coming up with the measures. It's all happening automatically. We believe our pricing is relatively inexpensive and, more importantly, offers a lot of upside for companies to take this market to product and capture value in their respective markets. And I think we are perhaps the only company with an aging clock that has a pure B2B business model. Our products are built for enterprises. When we build our products, we look at businesses, keep them at the heart, think about their needs, and then design products around that.
I want to talk more about the technology. How does Deep Longevity's technology work in practice? Can you dive a bit deeper how that would look for practitioners and clinic owners?
Sure. So the principle essentially is the same as is used by all the aging clocks out there. We are looking at a particular sample of a person, we are looking at the data, and then the AI is benchmarking what is this profile. Let's take an example and let's talk about blood age, and let's we look at we have 45 biomarkers in our panel, so the AI will look at the values of those markers and then will find the closest analog, and this could be a person who is biologically older or younger based on how the values are with respect to the age and gender of that person, and therefore that is suggested as the biological age, where I think we have done very well, and that shows from the wide adoption that we have had. We have customers in the US, in Europe, in Middle East, in Asia. We have been very successful in Asia, is that it works very well across populations. We are focused as a company to expand our products. Today, we are able to make age predictions using blood biomarkers, using a combination of blood biomarkers and clinical biomarkers like BMI and blood pressure. Despite everything that I have said about epigenetic aging clock, we have a very accurate, robust epigenetic clock of our own. But despite having an epigenetic aging clock of our own, I recommend to all the clinics and employers and insurers that they should look at blood age first, because it is inexpensive, it is widely available, and we have something very unique in our mind age clock as well, which is focused on preventive mental health. This is, we believe, something that has now come after years of research and is very clinically aligned with our blood age clock. When physicians, longevity physicians, look at the results, they are able to relate the results with the person, with the client, with the health of the person that they are treating. And this alignment is very important. It is a very nuanced topic. We'll probably should get together again, Henning, and talk more about this. But this clinical alignment where you expect the aging clock to predict things the way a very experienced physician would predict in terms of the health of a person is where we believe our secret sauce is. And this has happened through our research, looking at very large data sets, but also through multiple interactions that we have had with our customers, a lot of knowledge that we have gained from our advisory board, and that places us very uniquely in the industry.
Thank you, Deepanka. We are obviously speaking today because we recently partnered. And I think this partnership between Deep Longevity and Imagine Health will really drive adoption here in Thailand. Could you tell us more about this collaboration and why this partnership matters to you as well?
Absolutely. And we are delighted to have Imagine Health as our partner in Thailand. And this is something that we have seen is making a big difference. Having a partner in the country who really understands the culture, who really understands people, who understands how business works, who understands the priorities of the businesses, who understands the changing nature of the businesses, and a partner who understands the underlying aspirations of the country and its businesses is very important. So we are able to then position ourselves not only in terms of what is happening in Thailand today, but also in terms of what are the trends that are upcoming. And this is invaluable. And there are, and we discover as we get into business, and now we are operating in so many countries, regulatory requirements. There are certain documents, certain processes that are followed which are unique to a country, and that is unique to Thailand as well. And for us to navigate through all of those challenges would be time taking and difficult. Instead, if when we have a trusted partner like Imagine Health, which has the expertise in the region, which has the trust in the region, which has the network in the region, it is an absolutely delight for us to make that partnership, and a complete no-brainer that this is the way we want to do business in Thailand. And I'll just add one more thing is that we have had a lot of success in Asia, in Thailand as well. And then having a partner helps us accelerate that success because we have shown what the technology what the technology can do. We have shown the case studies exist. Now we need someone who shares that vision with us and is able to take that message to more and more enterprises in the region.
Deepanka, thank you very much for these very kind words. I can only return them, and also for sharing these insights today. Before we close, what's the one key message you would like healthcare leaders and individuals to take away?
Yeah, my one message to everyone would be aging can be measured and influenced through biological age. Biological age testing is no longer a luxury. It is accessible, it is available, it is actionable. We should all know that statistic like we know our height and our weight. It is my open invitation to clinics, corporates, individuals. Join us in this movement. Please get in touch with me. I'm there on LinkedIn and other channels. You can reach out to us through our website. We would love to work with you. And finally, our deep partnership with Imagine Health makes all this possible and available in Thailand. So I will encourage everyone in Thailand to reach out to Imagine Health if they are looking at biological health, if they are looking at longevity.
Thank you, Deepanka. And to everyone watching, if you'd like to explore Deep Longevity's solutions or collaborate with us at Imagine Health, please reach out. Together we can make longevity measurable and achievable.
Thank you.
Thank you.